National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March. This is a decisive measure to save lives of South Africans from infection and save the lives of hundreds of thousands of our people.
South Africa's president there announcing a sweeping measure to tackle the spread of coronavirus. I'm Femi OK. You're in the stream. You can share your questions and comments and join the conversation in our live YouTube chat, especially if you're in South Africa. The announcement on Monday of a lockdown came just hours after the official number of coronavirus cases in South Africa reached 402. The country is now trying to stop a mass outbreak that could be disastrous for the nation's strained healthcare system. COVID-19 was first confirmed in South Africa on March the 5th, and the country now has the most confirmed cases of the virus in sub-Saharan Africa. The nation has one of the highest levels of economic inequality in the world, and more than 80% of people rely on public health care. One of the government's biggest concerns is controlling the spread of COVID-19 in townships and informal settlements. These are areas where access to clean water for hand washing can be scarce and self-quarantine practices are difficult. Joining us to talk about these issues in Durban, Mosa Mosha Bela. He is the Dean and Head of School of Nursing and Public Health at the University of KwaZulu-Natal. In Cape Town, Ziviwe Haube. She is a Member of Parliament for the Opposition Democratic Alliance Party and the Shadow Minister of Health. And in Johannesburg, we're Al Jazeera correspondent Famida Miller. Hello, everybody. It's good to have you on a day where you've got really breaking news for South Africa. Mosa, let me share you something with you. When we were asking our audience of Africans, South Africans, global citizens, what do we need to do in South Africa? And MPDZA said we need a total lockdown. And here we have it. What does that actually mean from your perspective as somebody who knows about health and South Africa?
Yeah, thanks for me. From my perspective, I think it's an opportunity to be able to break transmission. If you think about it, the incubation period for COVID-19 virus will last basically about up to 14 days, even though on average it's about 5 to 6 days. And with that additional week of sort of a buffer, you would assume that anyone who gets infected before a lockdown, hypothetically speaking, would basically go through their symptoms and recover from COVID-19 within that 21 days. And in that period, when they are infectious, they're likely to be under lockdown, not going anywhere, or in a healthcare setting where they're being treated. And in a way that theoretically, from a public health perspective, that helps to contain the virus to the few that already have it. And it helps us to be able to break transmission, basically.
So, Viwe, I've learned so much in the last couple of days just looking at how South Africa is dealing with the coronavirus crisis. For instance, Business Insider South Africa, you are legally required to report a neighbour with the coronavirus in South Africa. If you don't, you could face time in prison. So, Viwe, can you explain?
Thanks, Remy. I think these are unprecedented times, I think, globally and in South Africa. And as such, you've seen an unprecedented amount of support for all the measures that have been put or introduced and then that have been put in place. And so what we've seen is South Africa grapple in the past week with some of the measures that were put in place and some of the issues that were announced in accordance to the National Disaster Management Act. And so some of these things around the legality of, who you need to report and who's liable for what, I think these are something that South Africans are grappling with. But I think they're absolutely necessary. I think, as you said right at the beginning of the show, we have a unique set of circumstances, and as much as we've learned from the global community, the reality is that South Africa has a unique set of circumstances of, our socioeconomic status of our people. There are over 50% of South Africans who are poor, over 11 million South Africans who are unemployed, and so really, we're going to need to be a lot more heavy-handed as we deal with this matter if we are going to be able to flatten the curve, so to speak.
Famida, I just want to bring in some video of testing and people being tested. And this was last week before there were very serious directives about how South Africans should behave. Let's have a listen to how the testing is going, because there's a cost involved in being tested, or there was. Let's have a listen.
Okay, my daughter was exposed at school on Monday, and then yesterday she started coughing, so that's why we've been in quarantine since Monday. I've asked the medical aid. They said they'll reimburse if it's positive. If it's not positive, then it's out of my pocket.
It's kind of like not accessible because they should do it maybe in public, like in public hospital, not only on this private, because of it means those people that don't have money or don't have medical aid, they're not going to be able to be tested.
People don't really have that much money, and I don't think people will want to spend that much money on getting tested. I don't think it's a first priority for a lot of South Africans, but I guess we'll have to try and make means.
This is a real issue, because the cost in terms of rand is pretty high to get a test. Can you explain more?
Well, I mean, the one thing I want to point out is with the first gentleman we heard from there, where he wouldn't be reimbursed by medical aid if his daughter's test was not positive. And that's concerning, because are people then hoping the tests come out positive so that they can afford it?
Yeah.
I do know there is one organization in South Africa who's being subsidized, is opening a testing center in Johannesburg, is in talks to open a separate one, so that cost can be reduced to potentially half the amount, which at this point stands at 1,400 rand, if people have to pay for those tests themselves. The government is providing free testing, but I think the difficulty people are experiencing is very much what we're seeing around the world, that you have to have certain conditions, or you have to have a certain recent history, like traveling, perhaps exposure. And the problem with that is that perhaps it's not taking into consideration the amount of community transmissions. South Africa has seen that happen in recent days when this outbreak essentially came from abroad, as some people would like to look at it. So the issue of testing is one that's concerning, especially in a country like South Africa, where there's this huge disparity between the rich and poor, and where many, many people can't afford being tested. And I think the issue of peace of mind comes into play. And on the other hand, you also understand the government saying, we can't test everybody out there because we simply don't have the capacity.
Sure. And did you see how close the dad was with the little girl? And the little girl was leaning over her dad. So I've got a feeling that if she was positive, the dad is most definitely going to be positive as well. Let me share something with you, Mosa, from YouTube. Our South African audience, our international audience are following our conversation right now. So VP says, hello from South Africa. I think a lockdown is a good idea. We don't have the healthcare to deal with the sheer amount of immune-compromised people. Mosa, do you want to explain about that, the immune-compromised people? Because we're talking about things like TB, as well as HIV, as well as poverty, right? That can be an illness too.
Absolutely.
Tell us more.
Absolutely. Yeah, for me, it's a big challenge. It's been interesting. We've been synthesizing evidence from different countries. A lot of evidence coming from China, Italy, the US, and in all of this sort of evidence synthesized by the WHO and other leading institutions, there's very little that we find in terms of reference to HIV patients and TB patients. But, for those of us in Durban, we are considered the epicenter of HIV, and a lot of TB research is also being done there. And the question has always been that when we look at high-risk categories, we say comorbid, thinking about cardiovascular, diabetes, hypertension, and we're also thinking the elderly. But now it's become very clear that we need to be specifically talking about health workers as a high-risk group. We also need to be talking about HIV and TB, but we are not able to explain the mechanism of how HIV and TB are a high-risk group with relation to COVID-19, because there haven't been societies where they have the sort of scale of HIV and TB like we do in South Africa and many parts of Africa. So it's very clear to us that we are walking into uncharted waters. All the kind of assumptions we have so far suggest that we are going to deal with a lot more severe disease in these sort of relatively younger people compared to what you see in Italy, where relatively dealing with severe disease in slightly older people. So yeah, it's going to be a challenge.
Yeah, Saviwe, I see you nodding your head. Before I go to you, and Famida as well, let me just bring in Cliff here, who has been tweeting us. The most vulnerable people are those living in slums, informal settlements, lack of sanitation, rural areas, lack of running water. But government urges people to constantly wash their hands. But I do believe that the president, Cyril Ramaphosa, he addressed that. He said, we are going to be taking care of informal settlements, putting water in informal settlements. It's almost like he saw all of the issues and then started ticking through them. Famida, go ahead.
Well, I mean, one question I would want, to put to the president is if, we do have the capacity to provide for these provisions for people who don't have alternatives, the homeless, people living in impoverished areas, in informal settlements. But the one point I wanted to touch on around the HIV in South Africa, and there are 7 million people at least who've been diagnosed with HIV. One is, that's the known figure. There are also people who've not been tested for a number of reasons. So there are people who do have a compromised immune system, and if not for this lockdown, could potentially be exposed to further risk. Also, we spoke to one gentleman this week who was HIV positive. He also runs an awareness campaign for the youth.
Sure, Famida, hold tight, because I'm actually going to get him to describe it for himself, because this is your reporting that you did for us on Al Jazeera, so I'm going to get him to tell his own story. Let's have a listen.
Hi from South Africa. As we were warned, COVID-19 is now on our doorsteps, and we are all scrambling to maintain social distancing in order to limit the spread of the virus. South Africans often regard themselves as quite a divided nation, split along racial lines. What this virus has taught us is that we actually need to work together to overcome it, as this virus will not spare anybody, whether it's rich or poor, black or white.
I'm going to bring in the gentleman that you spoke to in just a moment. Let's have a listen to him, because there's social distancing that's a problem, but also if you are vulnerable with HIV, you're HIV positive, this can be an issue. Let's have a listen.
It feels like it's another HIV reload of a sort, that we are actually re-evaluating something that has got a lot of fear towards people living with HIV, because we are in that denial of saying, what if I get infected? What's going to happen? What are the issues? What's the next steps?
So Famida, Mosa makes a really good point. What if? Who knows what will happen with South Africa?
And that is the major scare for millions of people in South Africa. People queue up at government public hospitals for hours on end to see a doctor, often having to take off work or school to get the attention that they need, spending an entire day at these overburdened, already stressed public facilities. And so that is a valid question for millions of South Africans. What do I do? And then also, how will it cope? How will these facilities cope with our already existing reality, never mind dealing with the COVID-19 crisis?
Let me just share, Saviwe, some of the government information that is going out there for people to, this is what you need to be doing. So let's look at flattening the curve South African style. I'm just going to play this graphic here. Have a look here, down here, which is pretty dramatic. I'm going to make it a little bit bigger so everyone can see that at home. There you go. And this is what the impact of social distancing can be. One more time there for you. But South Africa, like many other countries, they're really struggling to stay apart from each other. Saviwe, go ahead.
Yeah. Look, I think, Femi, the issue is multifaceted there. I think, one, it came this week as a shock to South Africans as to exactly what it is that is needed from them when we speak about social distancing. And so I think that's a function of, public communication and how well the South African government essentially informs citizens. And then I think the other element that, again, I think I touched on was the idea that South Africa has a unique set of circumstances that many other countries don't have. And that is the reality of millions of South Africans who can't, even if they wanted to, be able to practice social distancing or be able to self-quarantine or be able to protect their loved ones in any meaningful way or being able to stay away from work. And I think this is why this lockdown is also so significant, because I think a lot of South Africans in particular this past week, while they have perhaps wanted to personally be responsible by not taking on public transport or not going to work. But in reality is that a lot of South Africans, working class South Africans, have to go to jobs that are minimum wage paying, where if you don't work, you don't get paid. And a lot of them, the food is a big driver. And because we've got a large amount of South Africans, almost half of South Africans who are poor, the reality is that, if they don't go and work, and it could mean the difference between a meal or not. And so this is also why I'm very interested in how the interministerial task team is going to start to tease out some of these details. Because if you're going to be locking down the country and saying no one is able to move and go anywhere, meaning no one is able to earn a living in any meaningful way, particularly for the working class South Africans. So how are we going to cater for that? How are we going to cater for communities where they're going to need something as basic as a meal? And so that's why I'm going to be looking out for that press conference, because I think those ministers, they need to give life to some of what the president has outlined. Though, I felt that it was quite detailed and outlined a lot of public health interventions and economic interventions, but we're still going to need some of the details, particularly around how do we ensure vulnerable communities are taken care of? How do we intend on enforcing some of these limitations?
Sure. Let me just show you some thoughts that are coming.
I'd be curious to know if
For me to go ahead.
Sorry, Femi. I'd be curious to know if your other guests, have faith in that the government will provide meals, as the Minister of Social Development has alluded to, and also if there would be this tax relief, or also sort of a temporary fund so businesses don't have to retrench. Do you think that's enough, or is that where you're looking for further detail?
That's definitely where I'm looking for further detail. And again, President Ramaphosa showed a great deal of leadership tonight. And I think, where South Africans were looking to see exactly, what is going to happen considering the rising number of cases. And so that's good for a president to give us a clear direction of where we're headed. But again, this is where I felt that he was let down last week by some of his ministers, because then the next day the ministers had a briefing where they had an opportunity to say to South Africans, these are the details, these are the regulations, this is how we're going to enforce it. And it caused a great deal of confusion. And so this is now the real test, that tomorrow we've got a real opportunity for those ministers to come forward and to say, this is how we're going to enforce these limitations. This is how we're going to provide meals to vulnerable communities, considering the fact that there are millions of South Africans who are going to need that government aid. Where is the money going to be coming from? Will the finance minister give greater detail around the Solidarity Fund? Who's going to be managing that?
So many questions, Viwe, and I'm just going to remind people, they're just tuning in, they're just understanding what South Africa is doing. On Thursday, there will be a lockdown for everybody unless they are providing an essential service. You can still go out and get petrol or gas. You can still go out and get shopping and maybe medication. But unless you're an essential person on a list that will come out, you cannot go out. Let me show you how difficult it is to follow the advice that the government is giving and the health minister is giving in terms of South Africans washing your hands, not touching your face, staying away from other people. So this is on the health minister's actual Twitter page. And I want you to watch this gentleman here and this woman here, all right, this gent here, this woman here. And you know, all right, you know what we should be doing right now, wherever you are in the world. And the information is really important. But hundreds of people underneath this post are like, the gentleman with the gloves on, he needs to be careful. Official here, hand over mouth, even when you are briefing the nation, how difficult it is to follow the rules. And I'm also remembering, Mossa, I hear you chatting, chuckling there. About a month ago, and back in January, I was seeing the jokes. There was here's South Africa, here's the coronavirus. People were having a lot of fun doing it. South Africa was joking because they were way down south. It hadn't touched them yet. What is the mood now? Are people being serious?
Yeah, I think that for me, a lot of people are afraid now. And in my view, I think that we need to change behavior, and changing behavior is difficult. I like to touch my face, like a lot of people, and it becomes automatic.
Yeah.
But when we started off with the campaign, we said there is one level, which is having information and becoming aware. That is just one level. You can know something, but to turn it into behavior, that's a whole new level altogether. And so for as long as we don't engage and enforce that behavior change, to reach it becomes difficult. I actually think that I don't necessarily see the lockdown, in my view, as a way of completely breaking transmission. I actually see it more as an opportunity for us to position ourselves for this kind of new way of living going forward.
Mossa, you read my mind, because I wanted to bring in Dr. Tedros. He's the head of the World Health Organization. He is an African. He's an Ethiopian. And he is saying to health ministers around the African continent, you need to be careful, stay alert. And let me just share his thoughts with you.
In other countries, we have seen how the virus actually accelerates after a certain tipping point. So the best advice for Africa is to prepare for the worst and prepare today. It's actually better, if these numbers are really true, to cut it from the bud. And that's why we're saying we have to do the testing, we have to do the contact tracing, we have to do the isolation, and cut it from the bud.
So again, from the Health Minister of South Africa's own Twitter feed, these are the current stats coming to us on the 23rd of March. And these are the people that we know have it, or have been confirmed to have COVID-19. Look here, right here, no deaths that we know of. So South Africa could really get a jump. And this also, because we've been talking about all the things that could possibly go wrong, but perhaps here, breaking some good news, KwaZulu-Natal Health announces that there's been 4 recoveries in the province. I'm just wondering, Siviwe, are you optimistic about what might happen in South Africa from these recoveries, from the no deaths as far as we know it so far, and these pretty serious directives for what South Africa has to do come Thursday?
Yeah. Look, I think, Femi, the problem for me has been, I mean, I've seen there's been a great acceleration in terms of the tests that have been conducted. But if you looked a week ago, where we were, circling around the 3,000 mark of tests that have been conducted, and then we were saying on the basis of that, these are the positive cases. You see, obviously, if you're testing less, then you're obviously going to only discover a smaller margin of cases that test positive. So I am encouraged by the amount of tests that are being done by the NICD and some of its partners, because we're sitting at over 12,000 now. And obviously, as a consequence of testing more, we're going to be discovering a lot more positive cases. But I think if the South African government, as has been indicated by the president this evening, we can follow the great detail that we need tomorrow, and we can get South Africans to truly understand this.
All right, this is just the beginning for South Africa. Thank you so much, Zaviwe, Famida, Mosa, for joining us on a day that is breaking news for South Africa. There will be a lockdown this coming Thursday. So stay tuned to aljazeera.com. You'll see me at ajstream anytime. Thanks for watching, everybody.